Hi, I'm Dr. George Askew, Deputy Chief Administrative Officer for Health, Human Services, and Education in Prince George's County. I'm also a professor of the practice at the University of Maryland School of Public Health. And today I'm going to be talking to you about my module on colors of COVID-19, lessons from the front lines of vaccine access and hesitancy. In Prince George's County, our concerns about vaccine distribution efforts were all about the difference between equality, equity, and social justice. Simply stated, equality is about giving everyone equal shares based on a formula that doesn't meet or take into account where each person, group, or community stands at the beginning of the distribution due to other social, economic, and health issues. With equality, you don't achieve the same opportunity for success across the board. What you do is perpetuate a system by which those who are at the top at the beginning, those in the middle, and those below the middle will continue to occupy those positions as long as you use a formula that doesn't take into account other key factors to distribute a scarce resource. In this case, it's vaccine. Equity, on the other hand, gives each person, group, or community what they need to achieve success. This may mean that some person, group, or community may receive more than others based on what a simple formula might have called for. And moreover, social justice is fixing the system and removing barriers to access to opportunities. This is where you all come in. In our case, the state used a population-based formula to dole out vaccine. This didn't take into account the disproportionate impact that the COVID pandemic had on Prince Georgians. We had the most cases and the second most number of deaths in the state, and we were moving locally at a very different pace because of this disproportionate impact. Were you to account for, as we think you should, the disproportionate impact, the institutional and structural racism experienced by communities of color, and the current economic, health, and social challenges faced by Black and Brown communities, such as those found in Prince George's County, you would have to see plainly that the amount of vaccine reaching us was woefully inadequate. This included vaccines being distributed to our hospital partners who had the infrastructure to deliver vaccines on a large scale. We called upon state leadership to review their system of distribution to ensure all factors were accounted for in making the decisions about what gets allocated to each county. We also asked that officials not hide behind the veil of hesitancy to disparage a community that is eager and was eager and continues to be eager and anxious to receive the vaccine, as we saw with our pre-registration. The state responded with better distribution efforts and a vaccine equity task force, and we put together our own vaccine equity team to address these issues. We used a prioritization matrix largely reflecting initial anecdotal observations with looking at zip codes with high immigrant English as a second language populations that were pre-registered and booked vaccine populations at lower rates. We also looked at our inner beltway communities with existing social, economic, or healthcare disparities, and also pre-registered and booked vaccine appointments at lower rates. We did many things: phone calls, text messages, door-to-door knocking, enhanced transportation support, walk-in sites. First among those was vaccine education and outreach to trusted leaders and community partners. We enhanced our efforts at taking vaccine to the people rather than asking people to come to the vaccine. We went to our homebound populations. We increased our pop-up events. We went to apartment complexes. We went to schools. And yes, we are going to barbershops and salons. Large vaccines are closing left and right. The battle is now in the trenches. We need to go door to door, neighborhood to neighborhood, and partner even more with trusted partners serving smaller but equally critical, hard to reach residents. We need to work in places where frank conversations happen, where we let our guard down, where we tell it like it is. That's our barbershops and our salons, where we're among friends and even strangers and feel that we are safe and on safe ground to air our thoughts and our opinions and our reservations. So as you can see, personally, I don't have much need for a barber lately, but I still recognize a job you can do that is critical for me and our country. Help us get our Black and Brown people vaccinated. Your job is critical. If we aren't successful, COVID-19 will return in the fall. And while it doesn't care if you are Black or white, rich or poor, Republican or Democrat, it does prey most heavily on those who are already suffering health issues, and especially those who are not vaccinated. As a public health official, I am grateful for and I thank you for your partnership.